2014 are when some of the big changes come into play, and we'll talk about those. The big one is what is being called the shared responsibility for employers, and that's what is euphemistically known as the employer mandate. If you employ 50 full-time employees or more, you are going to be required to provide some sort of health insurance for them that meets minimum standards, or you will pay a penalty. You will also be required to report to the Internal Revenue Service the numbers of employees, the coverages that are in place for them. In other words, you kind of have to prove that you're covering folks. And the employees will also get information on that coverage. This is going to be difficult, obviously, for those of you out there to read, but I wanted to also give you some sense of the complexity that's involved in what ends up being a simplistic talking point. People say, what's the penalty? You know, and you hear, well, it's $2,000 per employee or $3,000 per employee. And, you know, those numbers are accurate, but there's a whole calculation that goes into determining that. You have to determine who's a full-time employee versus a part-time employee. Well, now a 30-hour week will count as a full-time employee. And you will have to submit these reports to the IRS with identifying information for all employees, certifying whether you are offering essential minimum coverage, your waiting period lengths, months during the calendar year for which coverage was available, monthly premium for the lowest cost option, employer's share of total cost of benefits, and the number of full-time employees. So that what ends up happening is one of the calculi that are being done by employers is to say, what do I do? You know, do I continue to have coverage, carry coverage for people, or do I drop them, let them go on a state exchange, and pay the penalty? So, you know, you saw that the thing to remember is you're exempted for your first 30 full-time employees. So if you only have 32 full-time employees, your penalty is not $2,000 times 32, it's $2,000 times 2. The first 30 are exempted. So in this case, there's a great website, franchise.org, but they have a calculator on that helps you kind of determine based on your workforce what your potential penalties look like. The wild card in this is, and a lot of people talk about what happens if you don't provide coverage. The wild card is, what if you do provide coverage and you have a number of employees that are eligible for federal assistance to get subsidies to get health care through a state exchange.